Morsch, nurse manager of the 2600 preoperative unit at Rochester General Hospital. Our comprehensive unit-based safety program, also known as our CUSP team, set out to solve a critical and common challenge: delays in rooming patients before surgery. These delays were disrupting first case start times, straining communication, and impacting both staff and patient experience. We applied the PDSA cycle, Plan, Do, Study, Act, to dig deeper and design better. Through direct observations, frontline feedback, and small tests of change, we streamlined pre-op flow and tackled delays head-on. Our goal was clear: room all patients within 20 minutes of arrival and have our 7:30 a.m. first case patients roomed by 6:20 a.m. And it worked. Our average arrival to room time dropped from 23 minutes to a consistent 15 to 19 minutes. We've sustained that for over 10 months. We also saw stronger communication, greater staff accountability, and smoother handoffs to the surgical team. It wasn't just a process improvement, it was a culture shift. This project showed what's possible when frontline staff are empowered to lead change. It's safer for patients, more efficient for teams, and a proud step forward for our unit.
Hello, my name is Emma Menning, and I am the Assistant Nurse Manager on the 3800 unit at Rochester General Hospital. 3800 is a 16-bed, all-private room unit where we take care of our orthopedic surgery patients and where we are the first unit at Rochester General Hospital to utilize a virtual nursing platform, Artisite, to help facilitate care. Virtual nursing takes place Monday through Friday, 7 a.m. to 7 p.m. During the virtual nurse shifts, the virtual nurse completes tasks that can be done remotely, like medication teaching, admission and discharge teaching, and documentation. This assistance gives time back to the bedside nurse, who can then complete hands-on tasks and spend more time face-to-face with our patients. The virtual nurse also provides an extra set of eyes on our patients and can alert staff to patients who are attempting to get out of bed, which has resulted in a reduction of falls during virtual nursing hours. Patients have really enjoyed virtual nursing so far, as they have had dedicated, uninterrupted time with a virtual nurse. We hope to expand virtual nursing to other inpatient units in the future.
Hi, I'm Dr. Herman. I'm the Service Line Division Head for Palliative Medicine at Rochester Regional Health.
Hi, I'm Kim Best, a board-certified music therapist in Rochester. We implemented a 6-month music therapy pilot at Rochester General Hospital on the cancer and palliative care unit that cares for the most complex patients dealing with cancer and advanced illness. Research shows that music therapy addresses the healthcare goals these patients have: physical, emotional, social, and spiritual. With this pilot, we explored the effects of music therapy on patient experience, quality of care, and staff satisfaction. A workflow and official clinical title were created in the electronic medical record. Education was offered to nursing, palliative care, other unit staff, and oncology team members. Nurse-driven consults identified patients for music therapy. Music therapy sessions were individually crafted to support the patient's background, music preferences, and healthcare goals. Live music was adapted based on the patient's needs and observed responses.
Out of 80 accepted visits, 69% of patients had decrease in anxiety and 56% had a decrease in pain. The results of the data show that non-pharmacologic treatments for pain and anxiety may be effective. There was an overwhelming positive response from patients, families, and staff. 100% of patients noticed benefits, 100% of families believed music therapy made a difference, and 100% of staff felt better about their work and caregiving experience. This pilot illustrates how offering music therapy improves patients' coping with their medical condition, reducing pain, and decreasing anxiety. It also leads to stronger connections between patients and the healthcare team, boosting staff empowerment and job satisfaction. Rochester General Hospital continues to look at ways to expand music therapy and service across the hospital.
Hi, I'm Tricia Fioravanti, Director of Nursing and Ambulatory Care Management at Rochester Regional Health.
And I'm Chris Ragsdale, Vice President and Chief Administrative Officer for Value-Based Care.
Together, we've launched the Daily Patient Check, a daily interdisciplinary huddle designed to better support our highest risk, most complex patients.
This collaborative meeting brings together over 20 different departments, including care management, social work, home care, nursing homes, primary care, and virtual care to discuss 5 to 10 patients each day and proactively address care transitions, barriers to access, and unmet support needs.
The result? Team members report that the daily patient check fosters improved workforce efficiency and effectiveness, and most importantly, improves our support for patients and the physicians who care for them. Among patients discussed in the huddle, we've seen a 69% drop in hospitalizations, an 80% decrease in readmissions, and a 50% reduction in ER visits.
The daily patient check is transforming how we care for those who need us most, together as one team.
Hi, I'm Jessica Wolf, Quality Program Manager and Team Leader for the Quality Outcome Improvement Initiative at Rochester Regional Health Home Care. In 2023, the Centers for Medicare and Medicaid Services launched its expanded value-based purchasing program. At that time, our agency ranked below the 25th percentile, putting us at risk for up to a 5% reduction in reimbursement. We also had a 3-star quality rating, highlighting the need for significant improvement in our quality outcomes. In response, we launched a 2-year cross-functional initiative to improve documentation accuracy and strengthen compliance, with the goal of achieving a 4-star quality rating and to be ranked above the 50th percentile in the value-based purchasing model. Our team, which includes the quality review team, education team, clinical leadership, and data analytics, focused on refining processes, understanding risk adjustment, enhancing OASIS accuracy, and embedding real-time education and audit feedback into our daily workflows. With the work performed through this project, we achieved both goals within 2 years, a 4-star rating and surpassing the 50th percentile in value-based purchasing by the end of 2024. Our home health agency is now proudly rated 4.5 stars, reflecting the sustained impact of our collaborative, data-driven approach.
Hi, I'm Gina Curtis, a quality specialist at Rochester Regional Health. The project began because we identified a spike in patient complaints and grievances. Patients alerted us that they had been dismissed, meaning formally removed from the care by their primary care provider's office without any communication or knowledge as to why. Many were complex patients facing layered challenges like chronic illness and/or behavioral health needs. Our policy was vague and teams lacked the tools to respond effectively in high-stress moments. This prompted a thorough review of our patient dismissal process where we identified significant gaps. This project was meant to strengthen how we manage complex and high-risk patients situations by providing staff with trauma-informed training, standardized documentation processes, and practical de-escalation tools. The goal was to reduce harm, increase employee and patient safety, improve consistency, and support both patients and employees. We created a dedicated committee called the Complex Case Committee to ensure all dismissal decisions were made thoughtfully, fairly, and in alignment with our organizational values. The results we saw from 2023 to 2025, the patient complaints dropped over 80%, dismissals fell from 25 to 2, and workplace violence incidents declined, making care safer for staff and patients. This wasn't just a policy change, it was a culture shift. Because at Rochester Regional Health, we don't just care for people, we care like family, especially when it's hard.
My name is Erica Kirsch, and I'm the Program Coordinator for the Admissions Team at Rochester Regional Health Addiction Recovery Services. This team reviews referrals and schedules admissions for 89 beds at 3 inpatient units. Our department identified a critical issue. We had open beds and patients seeking care, but our intake process was inefficient, causing lost patient engagement and strained relationships with key stakeholders. We also struggled with insurance denials and revenue loss. Our multidisciplinary team, including admissions, clinical leaders, and medical leaders, came together to streamline workflows, revamp our process for complex cases, and repurpose staff roles to reduce barriers to admission and manage insurance reviews. Since implementing these changes, we've reduced the time to admission by 31%. Our monthly average census has increased by 17%, admissions have increased by 10%, and despite higher patient volume, insurance denials have dropped by 12%, saving thousands each month. Through continuous improvement, we are ensuring better access and outcomes for our patients.
Hello, my name is Corey Braun. I am the Assistant Director of Pharmacy at United Memorial Medical Center. While our pharmacy team has always worked to improve medication management, we recognized we could do more to engage our frontline team and improve our culture of safety. In 2023, we started a comprehensive unit safety program. This created a framework where all team members became empowered to speak up and routinely discuss medication safety practices. As opportunities for improvement are identified, team members are able to sign up for tasks and receive recognition for their efforts. Over a year's time, our employee engagement score increased from 7.5 out of 10 to 8.9 out of 10, which was 1.3 over our system goal. Participation in our Culture of Safety survey increased by 45% over a year and a half. Our results indicated improvement in surpassing our goals in continuous improvement, leadership support for patient safety, communication about an error, and response to an error. Our pharmacy cusp team has been a great success with over 120 safety items identified and fixed, with involvement from all pharmacy team members.
Villa of Hope's Gregory E. Policini Living Hope Treatment Center opened in the fall of 2022. The first of its kind in New York State, this medically supervised detoxification program serves ages 16 and up. We knew from the beginning that we wanted to do more with this program to meet community needs. So in the summer of 2024, we formed a task force to take a look at just that.
And with that, the customer experience strategy was the main focus. Number one, service expansion with the addition of inpatient rehabilitation beds. We offer swing beds for flexibility. We offer 24/7 admissions. We offer telehealth services. We had some addition of staffing and structure. We have a dedicated medical director. Myself is the additional senior director of nursing. We offered a recreational therapist, adding therapeutic groups, and patient engagement.
Each of these milestones contributed to an immediate impact. Our utilization in the program jumped from 60% to over 80% in a short period of time. But we're not done yet. We're continuing the work forward, but we're happy to celebrate the progress that's already been made, especially that we can now serve both medically supervised detoxification people as well as people who need inpatient rehabilitation services.
Hi, I'm Jessica Wolf, Team Leader for a cross-functional initiative at Rochester Regional Health Home Care, aimed at reducing 60-day hospitalization rates, specifically among our patients status post-joint replacement. These patients represent over 30% of our eligible population for this quality measure. Our team brought together leaders and experts in clinical operation, triage, education, data analytics, and health system collaboration to address this high-risk group. We implemented a series of targeted strategies, including agency-wide education, scheduling strategy improvement, and a triage follow-up call within 4 days of start of care to proactively identify complications and improve recovery at home. In 2023, our joint replacement hospitalization rate was 5.3%, compared to a national average of 2.9%. Since implementing this initiative, we've achieved a 32.5% reduction in hospitalizations among this population, a measurable and meaningful improvement. This work not only improves patient outcomes, but directly supports our performance and CMS's value-based purchasing program, reinforcing Rochester Regional Health Home Care's role as a leader in high-quality, patient-centered care.
Greetings, my name is Chad Adler, and I'm the Supply Chain Director for Gorbel based in Fishers, New York. In the fall of 2023, we began a supply chain journey to drive real results to accelerate growth, profitability, and reinvestment, which encompasses two primary aspects. The first aspect is operating margin expansion through strategic sourcing via supplier relationship management, commodity strategies, and life cycle cost management. The second aspect is improving material availability to reduce customer late orders via stocking agreements, proactive inventory management processes, and establishing new scheduling positions focused on customer orders. These two aspects have contributed to a 30% improvement in customer on-time delivery and a 7.5% reduction in direct materials as a percentage of sales. While the journey to date has brought favorable results to be proud of, our work is not done. I look forward to the opportunity to continue to drive value for our customers, learn from my team, and lead the Gorbel supply chain organization in the future. Thank you for your time today.
Hello, my name is Sonia Gagne, ACOO of United Memorial Medical Center, and this is Carrie Cooper, our quality specialist. In 2022, patient length of stay increased significantly, raising the risk of complications, patient dissatisfaction, and higher costs. To address this, we aim to reduce length of stay by optimizing resource use while maintaining high-quality care.
Length of stay is a complex issue requiring coordination between multiple disciplines within the hospital, as well as partnerships with community care providers. Our multidisciplinary team created efficiencies within our current processes and implemented new strategies across the care continuum using existing resources. By improving collaboration and operational efficiencies, we reduced our length of stay over 2 years from 5.3 days to 3.52, without negatively impacting our readmission rates. This reduction resulted in a nearly $1 million RN labor cost savings.
Hi, I'm Jamie Waldridge. Asthma is one of the leading causes for children to seek care in an emergency room or be admitted to the hospital. The Rochester area has a very high number of children experiencing asthma exacerbations, especially in historically marginalized areas. Golisano Children's Hospital is improving the educations family receives about their child's asthma and how to take care of it at home. The team doing this work includes wonderful nurses, respiratory therapists, and physicians. This work is decreasing the number of readmissions and keeping kids with asthma healthy, happy, and in school.
Hi, I'm Dr. Sean Newlands, Chair of the Department of Otolaryngology at the Wilmot Cancer Institute.
And I'm Beth Kiss, Assistant Director of Oncology Nursing.
Our project addressed an important challenge, reducing the time from surgery to post-operative radiation therapy, which is critical for improving cancer outcomes. We focused on creating clear, standardized processes to communicate adjuvant radiation needs and track patient process in real time.
To make this work, we implemented a nurse navigator-led workflow and built new tools on our electronic health record to monitor patients and prompt timely referrals. These efforts led to measurable improvements in timeliness and equity, and the changes are now part of our daily workflow, ensuring patients continue to benefit.
My name is Jenna Podlucky, and I am a nurse practitioner at the Wilmot Cancer Institute here in Rochester, New York. At the Wilmot Cancer Institute, I am one of the Advanced Practice Service Line Managers for the Hematology Division and Inpatient Services. Through my work with the University of Rochester's Quality Institute Leadership Fellowship Program, I was able to work with a project team that developed and piloted integrating chemotherapy consent into the electronic medical record. The electronic medical record is the main source of clinical documentation used in care delivery, and the chemotherapy consent is essential for documentation between providers and patients, as well as care provision across many service areas within the Wilmot Cancer Institute. By streamlining this process, we were able to show that signing the consent electronically allowed for real-time population of the document into the electronic medical record. Ideally, this eliminated additional steps that were needed in the previous workflow and allowed the consent to be readily available for care delivery. Looking into the future, we are hopeful to move the electronic consent across other disease groups, into Wilmot's regional offices, and into our inpatient units.
Hello, my name is Dr. Christine Coward, and I'm joined by Dr. Jan Schriefer. We'd like to share a brief overview of our Health Equity Quality Improvement Project, Screening for Food Insecurity, and an outpatient ophthalmology clinic. This initiative integrates social determinants of health screening into the patient intake process at the Flom Eye Institute South Clinton office in downtown Rochester. Launched in January 2024 in partnership with FoodLink, the project includes an on-site food pantry, allowing patients identified as food insecure to receive emergency groceries during their eye care visit. Since its start, we've screened over 80% of eligible patients, surpassing our initial target, and distributed nearly 1,000 bags of nutritious, non-perishable food. This model demonstrates how specialty care settings can play a meaningful role in addressing food insecurity and advancing health equity.
Our team utilized a number of quality improvement tools to look over how the processes were working at the clinic. We used a fishbone, a key driver diagram, and one of the most important interventions was an educational infographic that was placed in all the clinic rooms. And then we also used annotated run charts to track the food screening that went from 60% up above 80 into the 90% range. And then we also tracked on a run chart the food bag distribution, which went from 0 per week up to over 40 food bags per week being distributed. And we just want to thank the URMC Quality Institute for supporting Christine Coward's Health Equity Quality Improvement Project.
I am Ben Wonke, founder and director of the Backstop Radiology Recommendation Management Program. The Backstop team, based in the UR Imaging Department, collaborated on this project with the UR Primary Care Network. Tens of thousands of times a year, UR radiologists identify signs of possible early cancer unrelated to the reason for imaging. Proper follow-up guidance was inconsistent, and timely follow-up did not occur about half of the time. This led to preventable delays in cancer diagnosis, which worsened patient outcomes, increased the cost of care, and raised malpractice risk. During this project, we were able to significantly increase the quality and consistency of the follow-up recommendations our radiologists provided. While learning how to work better as a collaborative team alongside primary care practices to increase timely follow-up examination completion from 60% to nearly 75%. While the Backstop program grows every year, we have also become better at reducing patients at risk for delayed cancer diagnosis, now by over 90%. We are a national leader in this area of patient safety, helping dozens of other organizations develop similar follow-up programs. Early diagnosis of cancer saves lives. Our Backstop team believes that every patient deserves their best chance for a cure.
At Highland Hospital, our emergency department was increasingly crowded, with boarding admitted patients waiting hours, sometimes overnight, for an inpatient bed. Rising volumes, limited capacity, and staffing constraints meant hallway care became common, creating safety risks, hurting morale, and exacerbating length of stay in the hospital. In order to address this issue, we formed a cross-functional team from emergency medicine, inpatient nursing, patient flow leadership, and performance improvement. Guided by DIMAC, our admission process identified bottlenecks and modeled solutions. In the first iteration, we expanded West Unit capacity from 26 to 34 beds per floor, adjusting admissions and staffing through PDSA cycles. 3 months later, the second iteration took us to 37 beds per floor and added 4 East Unit beds and opened a new ED Zone O as flexible surge space. These changes were hardwired into daily operations. Real-time dashboards track boarding hours and census. Surge protocols are ready to activate, and feedback loops keep frontline staff engaged. The results speak for themselves. Boarding hours remain far below modeled projections. Hallway use has dropped significantly, and capacity can now flex up to 152 beds during surges. Patients are moved to inpatient units more quickly, safety is stronger, and staff morale has improved. The project shows that when departments unite around a clear goal, align with system priorities, and stay disciplined with data, the gains aren't just possible, they are sustained.
Hi, I'm Dawn Michelle, the manager of customer service team at Lifetime Benefit Solutions and proud sponsor of the COBRA IVR Payment Automation Project. This initiative brought together leadership, project management, development, testing, and training teams to launch a 24/7 self-service payment option. Our goal? Reduce call volumes, minimize wait times, and give our members the flexibility to make payments anytime, even on weekends and holidays. Since launching in November of 2024, we've seen nearly a 60% increase in adoption. That means a better experience for our customers and more time for our representatives to focus on complex support needs. I'm incredibly proud of the collaboration that made this possible and grateful to GRQC for considering us for the Customer Experience Award. Congratulations to all the teams being recognized. Thank you.
I am Susan Reuter, proud owner of Flight Wine Bar at Cornhill Landing since December 2022. In our first year, we doubled sales, grew our customer base, and boosted positive reviews.
we have kept that momentum going in 2024 and 2025. This growth allowed us to invest in a permanent patio awning, a customer favorite that is already paying for itself. I am grateful for my loyal team who have been with me for over 2.5 years, giving me time to focus on growing the business, hosting private events, continuing to support local musicians with live jazz nights, and expanding our community partnerships. What I'm most proud of this year are our fundraisers and guest bartending events. We partner with local nonprofits, donate 20% of sales, and help raise additional funds through raffles and 50-50 drawings. Organizations like Veterans Outreach Center, Bridges Rescue, Compare Rochester, Sunset House, and Catholic Charities have all benefited from these fun, impactful evenings. These events have introduced us to new guests who keep coming back to experience all that Flight Wine Bar has to offer. Thank you for letting us be a part of the GRQC Awards evening.
Hello, I'm Amy Story, Director of Quality for Ambulatory Services at Rochester Regional Health. I'd like to share a brief overview of our PSI and HAC Review and Reduction Project, which we launched last year. Patient Safety Indicators, or PSIs, are measures developed by AHRQ to identify potentially preventable safety events, which are signals of possible lapses in quality and safety of care. Hospital-acquired conditions, or HACs, are conditions that develop during a patient's hospital stay and were not present upon admission. Both have a direct impact on CMS reimbursement, public quality ratings like CMS Stars and Leapfrog, and most importantly, patient trust. To address this, we have assembled a multidisciplinary team that meets weekly and reviews cases using tools like RedCap, Power BI, and Premier Benchmarking. These tools support real-time, data-driven decision-making and ensure our documentation accurately reflects the care that we provide. Since the implementation of this project, we have achieved a 42% reduction in combined PSIs and HACs. Beyond the numbers, this project has created a sustainable, system-wide approach that strengthens our accountability, transparency, and our culture of quality.
At Gorbel, we believe every employee has the power to drive meaningful change. Our continuous improvement idea system was born from a simple but powerful question. Are employees encouraged to share ideas to improve Gorbel? In response, our cross-functional team launched a transparent, employee-led platform that enables our manufacturing teams to identify problems, propose solutions, and collaborate across departments. Grounded in the principles of GEX, Gorbel Enterprise Excellence, this initiative began in our Goodyear, Arizona facility and quickly spread to 4 manufacturing sites, engaging over 250 employees. It's more than a system, it's a cultural shift towards enterprise excellence, where every voice matters and every idea counts.